East Africa. Now you're logged onto the continent's leading intellectual platform. I tell you, the highest platform for solution finding, the desk, a discussion that is always worth hearing. This is actually a show that we are certainly and absolutely sure is going to impact the entire overview of the political, the social, and above all, the economic atmosphere of this country and the East African region as a whole. Now more than ever, I am Shadrach Shagaf Kisame. And I tell you, as the world is continuing with the nightmare of the coronavirus, everyone is trying to find a solution. But I tell you, keep sanitizing, keep washing your hands. The president actually says don't touch the soft parts. I'll still say the same, do not touch the soft parts. Ladies and gentlemen, tonight is a very healthy episode. I'm telling you, we're only discussing about health. Now, my guest tonight, ladies and gentlemen, she's from a company. I was actually talking to my colleague, the founder, Julius, and he was telling me how he started this. It was when he was in the diaspora, and then he got an attack, and no one would save him for a couple of minutes. But just because their health system is a bit faster, they were able to come and get him. Otherwise, if they had delayed like a minute, unfortunately, would have kicked the bucket. That's how the birth of this company started. Now, I'm not going to do the introductions for them. She's a lady. She's very smart, very articulate. And I tell you, she is a doctor. The first time I saw her and she told me she's a doctor, I nearly refused. But anyway, anywho, she is a doctor. Welcome to the show, Dr. Hawa.
Hello.
Yeah.
Thank you very much for having me. My name is Dr. Hawa Maggembe. I work with Life Medical and Rescue, or LIMIA for short. I work as a trauma doctor, and I also work in emergency dispatch.
Okay.
Yeah. My role there is mostly, as you've heard, a trauma doctor, and a trauma doctor is not just any doctor. It's mostly associated with incidences of emergency, and also that I work in the dispatch system. Dispatch system is not yet established here. We are the first to do it, so most people may not follow when I talk about dispatch system. But basically, for most people, it's familiarly explained as something similar to 999.
Okay.
If you've watched movies in the US and countries that are more developed, they have a system where you can call in and then they can send you help.
Right.
Or tell you where to easily find help.
All right. So, Dr. Howard, let's just get the people up to speed, yeah, with LIMIA. So, with LIMIA, what are the services that you have? Is it ambulance? What are the different services that you have brought to Uganda?
So, the goal of LIMIA, as you hear, our motto is when every second counts, is mostly to eliminate the importance of emergency services and pre-hospital care in a country.
Right.
I think in East Africa, maybe even in sub-Saharan Africa, we may be the first to really push for the goal of emergency and pre-hospital care.
Okay.
Whereby we want to improve the services that someone can receive before they reach a hospital.
Right.
And this includes, say, you're home and you have a problem, we can come to you and sort it out from there.
Right.
Or we decide whether we need to take you to the hospital. It's not mandatory that every time you feel unwell, you have to go to the hospital. And I think that would tremendously decrease the health costs of people in the country.
Okay.
And also we want to make sure that Ugandans get quality service, pre-hospital care and emergency service care. But we ensure that we bring quality to our system provision. That's where we're bringing the idea of dispatch, whereby our system is dependent on the International American Emergency Dispatch.
Okay.
And we are certified as per their standards.
Okay.
And we use a system that's already qualified and already stratified in a way that there is a certain quality that's not distorted regardless of who's using the system.
Right.
So if, for example, you call us, you get the same questions from everyone who you call, who picks up from our end.
Okay.
And that helps us ensure that everybody gets the same service.
All right. So with this service, do you guys have a 24-hour customer service in case I got an issue, say 3 a.m. in the morning, and then I called?
Yeah, so definitely we're 24 hours, 24/7, Monday to Sunday. We're always having a doctor on station, a dispatcher, and a paramedic, together with an EMT.
Okay. She's told us what they do and everything, but let's just talk about the general health and the facilities of the country, just maybe diverting from LIMIA, your own perspective as a doctor, what would be your assessment for the general health facility of the country? Do you think we've improved over the years? Do you think we have a little much more to do?
I think we have definitely much more to do as any other country. I think our health system is in a dire state now more than I think 5 years ago.
Okay.
I think our systems have been tampered with. I don't know whether it's due to political or economic situation of the country,
Right.
but there's been a dilution of the systems that actually used to work, and now there's a lot of gambling with the health system. For example, we don't have a national emergency health system provision. We don't have our public centers, which are the government strive to make totally free, as contrary to how it was cost sharing before, because cost sharing made it easier. If the government couldn't afford somewhere, you would chip in and things like that. But now that they made it totally free, it's quite difficult to ensure quality service provision
Okay,
for every individual.
Sorry, but I understand from your end what you're talking about because you're a doctor, yeah. But we have youths down there, let's say in Chikuba Mutwe or down there that actually are living below $1, you know, and they cannot afford what you call quality. But if government is coming in and says, "Hey, I can do this for free," don't you think that's the right way to take?
I think the government should be able to do it for free and with quality at the same time. Free does not mean compromise on quality, because Ugandans, we pay taxes, and there are several countries like with the National Health Services of the United Kingdom, where people are provided these services solely from their taxes that they pay, and everybody pays taxes, regardless of if you earn $1 a day. Whatever you buy has a VAT on it, and you've paid taxes. So our taxes should be a large chunk, at least, should be diverted towards that health system, and of course, with I don't want to be presumptive, but assuming with the embezzlement and all that, there's a lot of gaps that we still have.
To close.
We have the proper skills and knowledge. The health workers are there, but the issue is the health worker cannot provide quality service if they don't have quality equipment to work with, if they don't have a proper setting to help the patient with. So those are the hindrances we face as health workers, and the gaps that our health system still has.
Right. As we go for a break, do you think that in your perspective, because a lot of our young women and men who have studied medicine are flying out of the country to go and get jobs elsewhere, and then you keep saying we do not have medical personnel in the country. What do you think we should, is it the payment plan for Uganda? How can we close this? Because you say as the health department, we are less of human resource, and yet these are the people live in the country. How can we close that?
So I'm not much of a politician, but from my view,
as a medical personnel.
Yeah. So from my view, I think definitely if you have been to a government setting, or a government hospital or Mulago, which is the most commonly known, you'll find that the work the doctor has to do in a given amount of time and the number of patients they have to attend to is quite overwhelming. And due to this overwhelming work, people get fatigued, and then there comes in things like late payment, and if the payment is coming late, then also there is the idea that the payment is not going to be enough. Okay. I think it's important to consider social public servants, if I might say, for incentives, yes. But you'll find that these days we don't have incentives anymore. I'm not incentivized to work 24 hours a day, even if I'm getting the same salary.
Is that why you guys are leaving the country?
I think it plays a very big role, because I mean, if you tell me that I'm going to work 24 hours a day, but I'm going to have a free house next to the hospital.
Right.
I'm going to have where my family is safe.
There's the doctor's village.
And that is not in existence
It's
anymore.
not a reality anymore.
No, because most of it was actually sold off. Because
Okay.
opposite Mulago, you'll see that's where the doctor's village used to be,
Right.
and it was sold off to a private investor.
Okay.
Yeah, so such things. I mean, if I stay in Nigeria and I'm a doctor,
Right.
and I have to work 24 hours in the hospital,
Right.
it's very tasking. But if I stayed in Wandega or in
Yes,
Mulago
yes,
itself,
right.
I wouldn't even mind working the 36 hours.
Yeah, you would reduce
So-
the friction.
Exactly.
Yes.
So it's the small things like that, because people think it's about salary, but to be honest, I would rather earn less here, but I'm in my country and comfortable,
Right.
than have to go overseas or somewhere,
Yes.
work, do the same work, earn more, okay, but you're not.
If you're just joining us, I'm afraid you missed the first insightful segment of this very lovely episode of The Desk, where we're talking health and saving of lives. I tell you, as the pandemic is still hovering around the continent, we are looking for most of those solutions that can aid us overcome. Now, if you're out there in the diaspora, The Desk is live right now on your YouTube. We are at the Nube now. Thank you very much for keeping yourselves on U24. Now, for you, if you're looking for quality furniture, walk into the Nube, Kampala Road, opposite Shell or opposite KCB. Lovely atmosphere, lovely people, and you'll surely get whatever you want in terms of furniture, homeware, and gardening. Like, this is an exclusive. We are in their gardening area, and my guest, Dr. Hawa, was telling me she loves the garden coffee set. I don't know what she called it, but anyway, so we follow this lovely discussion on social media platforms: Facebook, Instagram, and Twitter. Now, like right now, the bar on your screen right there has Shadrach Kisame, Facebook, Instagram, and YouTube. Just type in, go like the page, keep the messages coming in thick and fast. Now, that number right there is not for you to call me, because I'll not pick up. It's strictly WhatsApp or text message, and I'll be able to get back to you. Now, Dr. Hawa, you were telling us. Now, I want to, maybe for someone out there, or even me, to understand, this Precare thing is, you do not take someone to a hospital, the Precare services. You do not take them to a hospital. But at what extent do you say, okay, no, it is worse, we cannot handle you, go to a hospital? Is it like, is it more of, I don't know what actually it is.
Yeah. So to just explain in simple terms, when we say pre-hospital care, it doesn't mean that you therefore not go to the hospital.
Okay.
Yeah, pre-hospital care, we have what we call fight or flight situations.
Fight
Or flight.
Okay.
Yeah. So when we're called to a client or to a patient, when we get there, it's upon the doctor's discretion or the paramedic discretion to look at the situation and assess, should I be in a hurry to get this patient from here to the hospital, or should I help this patient here and I can move them to the hospital later?
Okay.
So that's what we call pre-hospital care. Okay. If you called me and you are home, say you tell me, or if your father or an elderly person in the house was home,
Say my wife is pregnant or something.
say your wife
Yes.
is pregnant, and you don't know what to do, you call us, as
Yeah.
most people would.
Yeah.
If we get there and your wife, say we can see the head of the baby,
Okay.
right, and she's already trying to push,
Okay.
we wouldn't rush to
The
move her to the hospital.
Okay.
Okay, we have the skills and capacity to help your wife from home. When your wife is stable, the baby is okay and alive, then we can move them to the hospital. Because
Is it a first aid thing?
first aid is more of basic.
Oh, okay.
So if you have first aid and basic life support, advanced cardiac life support, advanced trauma life support, then you'll have the HEMS, where it involves helicopter and air transport. Yeah, so
You have
those
that
are
here?
just the levels, yes.
You have a helicopter here?
Yes. So if you need air transportation, or if you're far away, we can come to you and move you.
Maybe as we continue with that, the different modes of your transportation. You have everything. You have the...
So in transportation, we have starting from the lowest level, we have the motorbike. That's the easiest way to explain it. But what it entails, it's the BLS care with an paramedic.
All right.
And usually what we do is, if you call us and maybe say you're having a heart attack, you know our roads and the way everything here is difficult,
Yes.
we can send someone with a motorcycle
Right.
to give that life-saving care
Okay.
while we're on the way coming.
All right.
Or sometimes people call us and they're not really sure what the problem is.
Right.
Maybe the person has chest pain. I don't know. The person is just feeling unwell.
Right.
So we can send the motorcycle first, assesses, and then can get back to us and tell us.
So the
"Look,
guy
this is
riding
the
a
problem."
bike is a medic.
Yes. Our bikes are not the basic bikes that you see on the
On the
not
road.
Bajaj Boxer. Yes. Our motorbikes are health grade
Okay.
motorcycles.
Okay.
Right now, I think the brand is BMW or something.
Okay.
But it's not really about that. It's about the way it's equipped, because it has all the equipment. If the person goes on the bike, they have the capacity to intubate. I don't know if you know what intubation is. If someone is failing to breathe, they can pass the tube.
The tube through the nose.
Yes, and to help them breathe. Yeah, they have the capacity to deliver babies. They have the capacity to help someone who's bleeding out. They have the
Right.
capacity to help someone who's having a heart attack.
Right.
Yeah.
And unfortunately, these guys actually cannot see the bikes right now. But the first time I saw that bike, when I was talking to one of your colleagues, I couldn't believe it, because it is a bike that is like an ambulance.
Yes.
It is equipped and it has everything.
Yes. So all our vehicles are ambulance grade
Okay.
and health quality.
Even I saw smaller ones.
Yeah. So we have a motorbike, and then after that, the next level, we have a doctor's car.
The smaller ones.
Yes. So the doctor's car is not able to carry an individual, but it's fast enough and moves faster than the ambulance. It's able for the doctor, lets the doctor go to the scene before waiting for the ambulance to
Or
get
to
there.
pick. Okay.
Yes. Sometimes when people call us on the hotline and they tell us their situation, they
Right.
don't know the magnitude of the problem.
Right.
So we can send a paramedic with the ambulance. When the paramedic gets there, they can say, "Oh, I need the doctor to come in."
Right.
And then that's the role of the doctor's car.
Okay. So just maybe to ask still what you think as this service that you have brought on the market. It's one of a kind. We've not been having that this Precare service. What do you think is going to be its role or contribution to the health system of the country?
I think already we're impacting the health system. I think the coronavirus incidents has really shown us how unprepared we are
Right.
as a country when
Right.
it comes to health systems.
Right.
When they stopped cars from moving, private cars, and people were scampering, looking here and there for ambulance services, and that's when actually that's what helped us to get the word out there that, look here, we're here, we can help you. And people would really be surprised and shocked at the quality of the service, because sometimes you put people in the ambulance and they're like, "Yeah, this feels like I'm in an airplane," or they're not used to that kind of quality.
Right.
And which is very saddening, because me as a Ugandan, I want my fellow Ugandans to be exposed to what it's supposed to be, and for them not to be complacent or comfortable with what they think it should be.
Tradition has
Yeah.
presented to them. Okay. My following are youths. Can they afford that service?
So everybody in Uganda, up to border people, have can afford our service, and we have done it in such a way that it's not based on, like, we do want to avoid when we come to help you, you pay for that service, because that would be expensive for everybody. Even
Right.
if you're an MP,
Right.
that would be expensive for you, because the cost paid at service provision is much more expensive compared to what we want to do actually is whereby people can pay service fees or subscription, what people most commonly are used to hearing as subscription fees.
More of a retainer.
Yes.
Okay.
So according to, if you're an individual, if you're a family, if you are a company, or if you're paying for maybe, say, your company and then a family, there are different packages, just
Okay.
as with insurance.
Okay.
But it's really affordable, because we have to put into, as if you went to an insurance company, they put in two contexts: your social, your financial standing, and then they give you a rate that's.
Because if you're talking about subscription companies and everything, it's not for Muntu Awansi. You're not thought about us.
No, we're trying because we have service fees that can go as low as 50,000
Okay.
a whole year.
Oh,
And
per year.
yeah, and I think
50,000
yes,
a year.
and I think most people in Kampala can try and afford that. I mean,
Mm.
we're trying to pull the country out of the darkness and into the light. Yes. Doing it is going to be a struggle, and we may not be able to come with everybody,
Right.
but we want to bring as many people as possible with us.
Right.
Yes, because we also have to put into consideration our staff and all
Yes,
that
yes,
and
yes.
everything like that. But we want to make it as affordable to everybody so that we can reach out to as many people as possible. Of course, there are incidences where someone will not be able to pay or is not able to afford. That does not stop us. If someone calls 0800 330 330 and gets in touch with us and tells us someone is dying on the roadside, they need help, I'm not going to first ask, are
Do
they
you
going
have
to
the
pay
money?
or
Yes.
yes,
Yes.
because I'm thinking about saving that person's life. So that's
Absolutely.
what we call the corporate social responsibility.
You reminded me, that's the question I asked Julius one time, and I'm like, Julius, I called you, and then I'm like, and then I don't have the money. Then what do you do after? You've given
I
me
mean-
your medical experience. You know, maybe actually my situation was worse, and you used maybe somewhat a lot of equipment, a lot of expertise, and then after, I'm not regular muntu wansi from maybe somewhere, and then what do you do?
Yeah, so that's our corporate social responsibility to our citizens.
Okay.
See, we're not going to not help someone because they can't afford it. We try to help as many people as we can, but also we encourage people to support us and subscribe
Okay,
to
right.
our platform so that it can keep us going. Because if we only provide free services,
Yes.
we may not be able to keep going as a company.
Yes, right.
As we wait, maybe eventually with time, our government or the Ministry of Health will want to work with us
Right,
and
right.
as it should be and make it easier for us to provide the services to everybody.
On that point of as it should be, after the break, we're going to talk about that. You do not like to politic, but you hint. Now, do not go away. I tell you, this is a life or death program. We're talking about people, health, and how they can get better. Now, do not go away. We are still at the Nube Home, Kampala Road, opposite Shell, opposite KCB, walking for furniture. Now, do not go away. The desk returns in a bit. Well, if you've just joined us, I'm afraid you've missed two powerful segments of this very lovely episode of The Desk where we're talking about health and life saving. I tell you, you can follow this very lovely discussion on social media platforms, Facebook, Instagram, and Twitter. You can do it for easily. Now, remember, The Desk is every Wednesday, 9:30 p.m. and for the repeats on Thursday. That number on your screen, please do not call me, just text me and you'll definitely be able to get in touch with me. Now keep the messages on Facebook, Instagram and Twitter coming in thick and fast. Now for you, if you've just joined us, this is the last segment, so you want to sit back, relax, better yet lean forward or even stand up because the desk has 10 minutes to go. You are giving us the number.
So our Twitter handle is Life Medical and Rescue International at LIMIA, INT.
Okay.
Yes. LIMIA is spelled LIMEAR
Okay.
and then INT. Facebook is also Life Medical and Rescue International.
Right.
Yes. We have a toll-free number which is 0800 330 330.
All right, you want to do that again
Yeah.
for them because they have issues. They tend to call me, now the doctor you had knows. So they don't call me. The
So
doctor
our
is giving
toll-free
you the
number,
number.
our emergency number is 0800 330 330.
Okay.
Yes.
In the last segment, we left off where you said that it should be that Ministry of Health should be providing such kind of services, maybe in conjunction with you guys. What do you feel should be done?
Yeah, we hope that with us starting the ball rolling and getting these things in motion, that it will stimulate the ministry to come in
Right.
and try to either work with us
Right.
or if they're not comfortable, they can even push it on their end.
Right.
Because in most countries where there is good emergency service provision, you'll find that it's government supported in in the USA, in most European companies like Germany, Netherlands, the UK. Okay, because this service is very, first of all, it's very expensive to provide. That's one. So when it has government support, it's easier to collect funds to keep the system running. As you see, maybe like you see a place like Mulago is very difficult to fund, but the fact that the government helps to push it is difficult for them to go backwards.
Yeah, that's true.
So yeah, the government should be able to work in support with us so that we can help everybody.
Right, right.
Because what you asked me before is how will you help Muntu Awansi and everything. So that's where the government should be able to come in and say, look here, regardless of who you are, if you're a citizen of this country, you will
can
receive
subscribe,
emergency
yes,
services
right.
from LIMIA.
Right,
And the government is answerable.
right.
Yes.
Taking me to that same point in depth, can LIMIA access village areas or remote areas or rural areas? And what would it take?
Okay, so at the moment, since we're a growing company, we're trying to, we cover at least Kampala, Metropolitan, nearby neighboring cities or towns, and we can, depending on the urgency of the situation, we can
Right.
even go as far as Gulu. But if someone is in a dire state or not doing so well,
Right.
usually we coordinate with the health centers in that region.
Ah,
Yeah,
right,
so
right.
if someone calls us and they have a problem and they need a life-saving intervention and we can't make it to them in time,
Right.
we can contact nearby, maybe say if they're in Gulu, we can contact Gulu Lacho Hospital and then they can be helped by the staff there.
Right,
Yes.
right. So because you see, saving lives should be priority, but we've seen in lockdown, we've had a lot of women who could not access hospital and they're trying to give birth. It's been a lot. It's been a lot. If you had come before COVID, do you think this would be different?
So actually, we have been here since December of 2019.
Okay. But the awareness, people did not
yeah.
know you were there.
Definitely. So we have been trying to work on awareness, and because of the nature of our systems and how it works,
Yeah, you can't advertise.
yeah, that's one of the issues. But also, the dissemination of information has to be handled very carefully,
Right.
because you want everybody to get the right information the right way.
Right.
We don't want to just give out information randomly. If I tell you, we're here, we provide emergency services, you'll get it as ambulance, as most people will.
I thought it was ambulance.
Exactly.
Yeah.
But we want to let people know that it's more than just ambulance. It's
Right.
more than me coming, picking you up and taking you wherever you want to go. It's more than that. It's about helping you, saving a life,
Right.
making every second of your life count.
Right, right.
Yes. And also we have introduced the dispatch system, which helps, even because sometimes you can't tell me there's no ambulance and there's nowhere in the world where an ambulance can get to a sick person in less than 1 minute.
No,
It doesn't
it's-
exist.
it doesn't exist.
And our dispatch system closes that gap, whereby if the ambulance has set off from the office or from the center and it's on the way to the person, even the person on dispatch or on the phone can give easily understandable instructions
Okay.
to the caller that can save their lives as we get there. Because if you call me and tell me my baby is choking, I'm not going to tell you wait for the ambulance, we are coming.
They could be dead.
Yeah, exactly. We would be coming to pick up a dead body.
Right,
So
right.
the dispatcher can give you very easy to understand instructions that can save your baby's life, that you can do yourself.
And you don't even have to pay for that.
Yeah, no, you don't have to pay for that.
Wow. Actually, in depth. So let's say we have. Okay, right now events are not on, but let's say we have events. Yeah. And maybe we have in what events? What events? I'm a pastor, you know. Let's say we're having a night prayer, and and there are a lot of people. Let's say thousands, like maybe 7,000, and then what services could you render for such a space?
So for that kind of situation, we have a hospital, the portable hospital, if I might say.
Portable hospital.
Yes.
You just carry it to the.
Yes, we can carry the hospital with us. It's for someone who lives here, it can be easily described as a tent, but it's not really in a tent form, but that's not only what it's about. It's air conditioned and everything to make sure that we have a stable environment that's healthy for the
So
patients.
you seal off a space.
Yeah, so we seal off a space with a health grade enclosure.
Health grade enclosure.
Yeah.
Medical terms.
Yes, and we have to make sure that it's out of reach from anybody.
Right.
And then we also put like the reflectors to keep and there's also a health grade light that can easily show people that if you need help, you can find us here. And usually we also have beds in there. We can handle up to about 25 people in that portable hospital.
What kind of GI equipment is this that can house 25 people?
I don't know. I didn't come with the photos. I could have easily shown you. But when you get time, please, you can pass by our offices.
Definitely.
You can have a look.
Where are your offices? You want to tell them?
Our offices are at the Nalia Roundabout. If you reach Nalia Roundabout, there is offices. Just you can see our banner. It says Life Medical and Rescue International.
Right.
And when you reach the Nalia Roundabout, it's quite obvious. You'll obviously see us.
You know, we can never exhaust everything on the desk because the time always gets to us, and it's that time of the show where you have to give the climax. You know, give your last words to Ugandans. I want you to assure Ugandans that they are safe with you guys.
Definitely. Just to repeat what you've just said, our primary concern is our Ugandan safety and health improvement. That's our primary concern. And the reason why we are doing this is not because of anything else, but to show Ugandans that they deserve better.
Right.
They deserve the best. And we're bringing the best to them as much as we can to our best capacity. As you talked about earlier, Mr. Julius, who I work with, he's the CEO at the company. He told you his story of how he almost died.
Yes.
He was living in the Netherlands and he was saved by their health system just in a matter of 15 minutes.
Right.
And I don't think that's here. And that's what stimulated him. When he went through that experience, he came back to his country and said, look here, I have to save my own people.
Right.
It's not fair for me to get this service out of a country that's not mine, and when I'm home, people can't even get the smallest thing as someone coming to help a mother deliver at her house. So we are pushed by passion, by love for our country and our fellow citizens, and we want better, we deserve better. And we're always there for Ugandans. If you call us 0800 330 330, we can give you more information. The number is toll free. That means free to call. You will not be charged any cost for calling us, and we shall not charge you for any information we give you.
Right.
Yes.
So you want to finally tell Omuntu Wawansi that you have them in your plans?
Yes, definitely. We are trying to work out service plans that fit everybody's income and social life, so that we try to, as much as we can, to cover everybody. Of course it's slow progress, but we shall get there.
Okay, it's a wrap now. Thank you very much, Dr. Hawa Maggembe, for coming to the show. You see, I like to handshake, but you guys have told us not to. You know, I used to like handshaking with my guests, but like the president says, or what soft parts, or what, I do not know. Now, you've been a lovely audience. Thank you very much for keeping yourself glued onto U24 television. Now, we trust that every time you watch U24, you're inspired, you're motivated, and above all, you are educated. Now, it is a wrap. Thank you very much for watching The Desk. We're sure that every time you watch The Desk, you get a solution, you're inspired, and you get educated. Like tonight, we've been talking a lot of science, a lot of biology. Now, for you who did not really like it in school, you cannot run away. Now, from me and the entire U24 management, would like to sign out. Would like to say good night, good luck, adios, for God and my country. God bless beautiful Uganda.